Well, there are so many things that can bring a smile to your face. The sight of a beautiful rainbow, looking into the eyes of somebody that you love, or hearing your favorite song on the radio. But for some people, smiling hardly brings happiness because it reveals damaged or even missing teeth. But it doesn't have to be that way. Today marks the third in our four-part dental discovery series, exploring advancements in pain-free dental work. And in this segment, we are learning how some women are getting new chances to comfortably flash their pearly whites. Here to tell us more about this morning is Dr. Wayne Harrison, the VP of Sales and Marketing for WaterLase Technology. Wayne, always good to see you. Good morning to you.
Good morning. Good to see you again.
You know, when you don't have a good smile, it does kind of wreak havoc on your psychological spirit and how you feel about yourself, doesn't it?
Well, you know, as a dentist myself, having practiced for 16 years, you know, when I go into the department store, I go into the grocery store, I'm always looking at people. I just see smiles.
Are you always looking at teeth?
I always look at teeth.
How are mine looking?
Your teeth are amazing.
I paid him for that.
Yes, you have a great smile.
Thank you.
But you know, you look at so many people
Sure.
and they're so beautiful, and that smile just frames everything about your body. It gives you your self-confidence, your ability to get a job. It helps you form relationships. And you wonder, my goodness, if they would just come to my office for an hour, I could just really make that smile better. And then you realize, you know, it's their fear of what may be involved with fixing that smile that keeps them away. The needles, the drills, the post-op pain that they may think they're going to have.
Are there any other procedures then out there that can kind of lessen the pain?
Well, you know, what's really neat about the WaterLase dentistry is that we can actually do these smile makeovers many times with just a topical anesthetic, and there's so many other things we can do with the WaterLase technology as well. We can do cavity preps with no anesthetic, we can do gum disease, we can treat root canals, and then of course our segment today talking about a smile makeover. It's just perfect for that.
And I can't wait to get to these before and after makeovers. When you all see these, I mean, we've got some pretty remarkable examples and some great transformations. So let's go ahead and check it out. All right, Wayne?
Fantastic.
Let's go ahead and put up the first patient on our screen here. Tell me about the situation with this young lady.
Well, this is a case done by Dr. Patrick Broom, a cosmetic WaterLase dentist in Charlotte, North Carolina. And as you can see in this before picture, this patient has a short tooth. Her front tooth on our left and the patient's right is a little bit shorter than the other teeth. You can also see that the tooth has had a previous restoration. So what Dr. Broom is going to do is remove the existing restorations. He's going to recontour the tissue using the WaterLase, and then he'll be able to create some new veneers for the patient, and she'll have a beautiful after smile.
Well, let's look at that after. Here we go. Let's take a look. Wow, what a difference.
Well, you know, the even more remarkable thing is traditional surgery would have required that we would have possibly used a scalpel and sutures, and we wouldn't have been able to get the result we got. This is literally a 7-day post-op result.
That picture is from 7 days later?
7 days later.
Wow. Good stuff. All right, let's move on to our second one right now, because I know you brought yet another example to show us. Who is this?
Well, this is a patient of Dr. David Esham. He's a WaterLase cosmetic dentist in La Jolla, California. And this patient, on the other hand, is very much the same. She didn't like her short teeth. The appearance of her teeth to her when she smiled, it was what we would call that gummy smile. So again, using the WaterLase technology, you can see that on the video footage there, that they're actually using the handpiece from the WaterLase to be able to recontour the tissue. And what you'll notice is there's no bleeding, and there's nothing associated with that.
All right, well, let's move on to the after and take a look at, wow. That's the same. That's the same set of teeth.
Yeah, that's a wow. And I guess now that we've done 3 segments together,
Yes.
You're kind of an unofficial dentist. So how many veneers do you think, Danielle, we had to do on this particular patient?
Oh, I would say, in my expert opinion, you probably had to do the whole front row with veneers.
Well, you know what's interesting is no veneers were done on this patient.
None at all on these pictures?
No,
on
and
this
again,
patient?
this is 7 days post-op. So her own teeth were so naturally beautiful that all we had to do was recontour the gums, and Dr. Esham did that very, very beautifully to give her this wonderful after smile.
What remarkable before and after pictures. What is the takeaway? What do you want to leave our viewers with this morning, Wayne?
Well, I mean, I think the takeaway is when you look in the mirror in the morning, and if you don't like your smile, call a WaterLase dentist, and we can, get you in with somebody that can evaluate that smile, do the proper diagnosis, and give you some of these results that we shared with you today.
I have to tell you, great information as always, and always good to see you, Wayne. Thanks for stopping by.
You're welcome. Thank you.
And if you want to find out if your dentist offers WaterLase or how they can, simply go to the website. It's waterlase.com. And don't forget to keep watching our Dental Discovery series for even more insights that will make you smile.